Ladies and gentlemen, when you start thinking about treatment to be considered, you should follow guidelines. But take an important opinion here. Guidelines are to be respected, but not to be followed blindly. Guidelines can be applied in certain countries and not applied in other countries. So we should take care about this. Our population maybe is different in the Middle East from the Western country. Anyway, the targets of blood pressure to reach in our patients in the year 2016, that is, say, 2 years ago, when you treat a blood pressure patient, high blood pressure patient, you in the general population without diabetes or chronic kidney disease, your target will be equal to or less than 140/90. In diabetics and also chronic kidney disease, the same will be applied, equal to or less than 140/90. These were the targets of blood pressure in 2016. But also you should take care about two different exceptions. One is the patient with diabetic nephropathy and hypertension. The Canadian Hypertension Education Program, what we call the SHEP, advised to have the target less than 140/90, but 130/80. Also take care in patients above 80 or equal to 80 years of age, what we call octogenarians, their target of blood pressure is 150/90. So when you give treatment, don't go below this figure in patients above 80 years of age, because these patients, if you go down to 120/80 and they are 80 years of age, they will definitely consider, they will go into complications like dizziness and unsteadiness and decreased renal perfusion and so on. So what about talking about the new guidelines in hypertension from the American Heart Association in 2018? These were published, these new guidelines from America, after the SPRINT trial. And the SPRINT trial made an idea or a suggestion that all patients should reach 130/80. And if you want to talk about the SPRINT trial, I'm going to give you a few points about it. They were hypertensive patients without comorbidities, and their blood pressure was more than 145/95. And the treatment given was only lifestyle modification, diuretics, and beta blockers, nothing else. And their target, as I said, is equal to or less than 130/80 to all patients, what we call all one size. The SPRINT trial, the cardiovascular mortality and heart failure were significantly reduced. A good result. Therefore, you can say, well, all my patients will go below 130/80. But you have to take care. These hypertensive patients were on statin therapy in 43% of them. And also 58% were taking aspirin and diuretics, of course, for hypertension. So if you come and say, cardiovascular mortality has been decreased because my blood pressure was 130/80, but you have to consider these patients were taking aspirin and statins. Design not right. Now, the SPRINT trial also mentioned that adverse events were very mild, were very more significant, in spite of reduction of cardiovascular mortality and heart failure. As we know, heart failure were treated by diuretics and also loop diuretics and beta blockers, of course. These patients were taking beta blockers. So definitely heart failure was reduced because of these drugs also. Hypotension, hypokalemia, and hyponatremia were significantly more in this group who reached 130/80, indicating that the diuretic therapy and the beta blocker therapy were participating in these adverse events, which were significant. So, okay, let's say, supposing we are considering all patients to reach 130/80. What's going to be the result? Your number of hypertensive patients will increase in the United States, for example, from 72 million to 100 million individuals. This in itself is a heavy burden on the healthcare system. What about the cost? Of course, the cost will increase. And not only that, many patients will be considered hypertensive if their blood pressure is 135/85. This definitely will be a psychological trauma and it will affect the quality of life. So the SPRINT trial, if you really read it properly, you are going to be mishappened by the cardiovascular reduction mortality and the heart failure because the patients were taking other medications.